Hi, Don here. Welcome to the Podiatry Management Minute, episode number 48. I want to share today how I send Percocet electronically. This is something I wasn't able to do in the past. I am able to do it now. How do I do this? The way I do it is when I see patients for something called a pre-surgical discussion. It's 30 days prior to doing surgeries. I sign the consent, and then I actually send over the medications. I usually operate on Wednesdays. And so I have the medications show up in their pharmacy on the Sunday before, or like the Monday before. And instead of sending it to the pharmacy that day of the surgery, I send it electronically before. How do I do that? Well, within my medical record, it has an option to do that. And it's linked to this thing called Semantic VIP, and it's a security code. So it's like a two-step verification that's on my phone. So when I send it over, I have to put in my password for my medical record. And I have to put in the security code, and don't worry, you can't steal my security code. Okay, this just it repeats every 30 seconds or something like that, or every minute. And you take this code, you put it in there, and it sends it electronically. I have a few challenges. I've had it a couple times where patients will get the Motrin and the Vistaril, but they won't get the Percocet because it's holding, and that's what I find nowadays with pain medication. Sometimes they hold them a little bit, so that's why I send it a few days prior. What's the only drawback? The only drawback, I guess, is if they cancel surgery or if they're a seeker and maybe they don't get the medicine or they don't do the surgery, or the pharmacy isn't able to accept electronic prescriptions for those schedule of drugs. Anyway, that's an idea of sending it electronically. You check with your EMR provider to see if they can do that electronically. It's just a little bit easier, so you get one less thing to do the day of surgery. And so the way I do it in the medical record, I prescribe it, and there's a way you can choose the date that you want it to send. So I send it like 27 days later, it actually shows up. So that's a good way of doing that. You can do that with other types of exams. You could even do it with Lamisil if you want to prescribe another dosage of that in the future. Okay. Let me know what your thoughts are. Please post underneath this video, subscribe to this page, and like this video. Thanks.